The vast majority of women diagnosed with breast cancer have the ability to choose between a lumpectomy or breast conservation, keeping your breast, or a mastectomy, complete removal of all of the breast tissue with or without reconstruction, reconstruction being a personal choice. So, of all the ladies who are diagnosed with breast cancer, approximately 85% can have the ability to keep their breasts, or breast conservation, lumpectomy. But for the 15% for whom lumpectomy is not a good option, we will recommend mastectomy. It's actually 15% is a pretty small group of people. So, who do we recommend mastectomy for? I will tell you. So, mastectomy is recommended first and foremost for ladies with a genetic predisposition. I believe that everybody with breast cancer should be given the opportunity to undergo genetic testing. If you only use guideline based rules for testing, you will miss half of the uh, abnormalities that might be actionable that we might inform treatment for you. So we believe that everybody should have the option to do genetic testing. It is covered by the vast majority of insurance providers, and the out-of-pocket cost is like down to $250. Don't get me wrong, that is a fair amount of money, but like 8 years ago it was like 4,000. So relatively speaking, it is more affordable, but the vast majority of insurance companies cover it. So genetic testing, because for the ladies who do have a genetic predisposition to breast cancer, one of the quote unquote breast cancer genes, this is one of those rare scenarios where we will discuss removing both breasts preventatively, not only to treat the actual breast cancer we're dealing with, but also to prevent new breast cancer. The second group of women for whom mastectomy is a better option is ladies with what we call multicentric disease. Okay, multicentric disease. What does that mean? Well, basically, we take the breast and we divide it into 4 quadrants like this. If you have a cancer that is down here, small little tumor, no big deal. Even if you had another cancer sitting a little ways away from it, that's okay. We can still do a lumpectomy like that. However, if you are found to have a small cancer over here and precancer cells over here or over here, we can't make Swiss cheese out of the breast, right? There's no way to take out a whole bunch of different little sites and leave a normal looking breast. So, multicentric disease is one of the general indications for mastectomy when it involves multiple different quadrants, we say, of the breast. The third reason we may recommend mastectomy over lumpectomy is ladies who can't or won't get radiation. And that is because after a lumpectomy, radiation, for the majority of women, will reduce the risk of recurrence in the breast. It's not true all the time. For all populations of women, women over 70, we can sometimes avoid radiation, but as a rule of thumb, lumpectomy and radiation generally will go together. So, in many cases, a lumpectomy alone, the recurrence rate would be inadequate. And so, for those women who maybe don't want to have radiation, mastectomy would be a better option for them. So, that's number 3. Number 4 reason is cosmetic. I write this in quotes, cosmetic, not cosmetic like I wish my boobs were bigger, smaller, or more beautiful. Cosmetic in the sense that if the cancer is large relative to the breast size, the purpose of a lumpectomy isn't to take a tiger bite out of somebody's breast and disfigure you. That's not acceptable, disfiguring people. So if the cancer is large relative to the breast size, then sometimes from a cosmetic perspective, you actually get a better outcome, better symmetry between the breasts by removing the breast and reconstructing it. So that's what I mean by cosmetic. These are the 4 general reasons that the doctor may recommend mastectomy. So genetic predisposition, multicentric disease, unable to get radiation or refusal to get radiation, and for cosmetic reasons. Now, sometimes the doctors say, well, you could do lumpectomy or mastectomy. Consistently, about 1/3 of women will choose a mastectomy, usually a bilateral mastectomy, when lumpectomy was an option for them. Why do people do this? A whole host of reasons that they do it. I don't feel like my job is to tell you what to do, but I certainly would not recommend more surgery than is required to treat the problem. Why would I do that? But you have the option to choose that. I like to have an open discussion about why you're choosing more surgery than is required to treat the problem. All the time I hear, well, if I just have my breast removed, then my cancer would never come back. I wish it were that easy. Because if that were the case, then wouldn't we just tell everybody to have their breast removed? I mean, we would never advise somebody to do a lesser procedure that made their cancer more likely to come back. So unfortunately, it's not that simple. Mastectomy is a great operation. However, it is not perfect, right? The recurrence rates after mastectomy in general are about 2 to 3%. That's not a lot. It's also not a little. And it's not zero. So those rates are a little bit higher if you have a much larger tumor or you have a lot of lymph nodes involved. But generally speaking, mastectomy offers a low recurrence rate, but also lumpectomy with radiation has the same less than 5% recurrence rate. Most importantly, lumpectomy combined with radiation has the same overall survival, long-term survival, as mastectomy. So that means you do not live longer if you choose to have your breast removed when the clinician says it's not medically necessary. You have that choice. It's your body. You can do whatever you want with it. But I just don't want people to choose mastectomy over lumpectomy because of a false sense of security that they're going to do better or they're less likely to die from their breast cancer or their cancer is less likely to come back, because unfortunately none of those things are true. The thing we worry about most with cancer, of course, is having it come back and spread to another part of the body. With the breast, that's usually the liver, lung, the bone, the brain are the most common sites. The chance that any cancer will return and come back at a different part in the body is generally based on the biology of the disease. So, how aggressive is the nature of that tumor? There's a lot of factors that go into that, but the biology of the disease is the biology of the disease, meaning if you take the cancer out of the breast and you radiate it, the biology of the disease is still aggressive or not aggressive. If you remove the whole breast and you have the biology of the disease, it's the same. It's either aggressive or it's not aggressive. So what happens spreading to the rest of the body has nothing to do with the surgery that you have, which is a really difficult concept sometimes for people. Will having a prophylactic or preventative mastectomy decrease the risk of a new cancer in the future? It will. However, if you do not have a genetic abnormality, so if you do your genetic testing and it's negative, and 90% of the time or more, it will actually be negative, meaning we don't know why you specifically get breast cancer. But when the genetic testing is negative, that means that the chance of you getting a new breast cancer unrelated to the one that's currently being treated, the chance is about 1/4 to 0.5% per year, which really isn't greater than any other random event happening to you, like colon cancer, thyroid cancer, melanoma, pancreatic cancer, like any other random event that could happen to anybody. So really doing a whole bunch of aggressive preventative surgery isn't necessary. Can it reduce the risk of a new cancer? I mean, it can, but here's my analogy to that. If you say, well, I'm frightened, I don't want to get another breast cancer in my life, so I want both of my breasts removed. The analogy is if you were undergoing a screening colonoscopy, let's say, looking for colon cancer, and they found a tiny little cancer, say, for example, in the right side of your colon, they'd probably send you to the colorectal surgeon who would say, hey, I'm going to use the robot and we're going to take out a small portion of the right side of your colon, hook you back up, and get you out of the hospital in a couple of days. It'd be a pretty reasonable surgery. You probably would not tell your treatment team, you know what? I am really frightened of getting colorectal cancer again. So, what I'd like you to do is, I'd like you to cut out my entire colon and rectum, sew up my butt, and give me a colostomy, right? Nobody would ever say that. They just wouldn't. Now, people obviously do not have an emotional attachment to their colons, and people do have an emotional attachment to their breasts. So, that's, of course, a difference. And obviously living without a colon is a little bit different than living without your breasts, but the analogy is the analogy in that people are afraid of getting a second breast cancer, so they just want to take it all off, but you're not as afraid of getting a second colon cancer and you just want to take your whole colon out. So sometimes we have to just sit with this concept for a while. Again, it never matters to me what a patient chooses. A woman, I don't live in their body. I support whatever decision my patients make, and there's never any judgment associated with it. It's my job to make sure that you have the correct information with which to make your decision. And for some women, the anxiety surrounding getting mammograms in the future, getting MRIs in the future, potentially having abnormal imaging and needing a biopsy is just, it's more than they can just mentally tolerate. And so for that sort of peace of mind, they opt for more surgery than is necessary to treat the problem. Okay, it's totally your choice. Again, I just like to make sure people aren't doing it under false pretenses, meaning they think it's going to make them live longer. So it's very personal choice, and whatever you want to do is what you want to do. But again, the whole point of this video was to explain why the doctors would recommend mastectomy over lumpectomy, which only happens about 15% of the time. But to review, mastectomy, when you have a genetic predisposition, we might recommend it for some certain genetic abnormalities. If you have multicentric disease, multiple spots in different quadrants throughout the breast, the best way to get all the disease out is to remove it, reconstruct it if one desires. Women who can't get radiation, they have a medical condition that's contraindicated, or don't want to get radiation, aren't comfortable with it, they too, mastectomy may be a better option. And then cosmetic. Sometimes we get a better cosmetic outcome if the tumor size to breast size ratio is not favorable for a good cosmetic outcome. And those are some general rules, but determining lumpectomy plus minus radiation versus mastectomy can be a very difficult decision for people. So you want to do it with all of the information that you can have. Now, with mastectomy, usually people don't need radiation. That is not true all the time. About 15% of the time, we will recommend radiation after a mastectomy. When does that happen? Radiation after mastectomy? Well, my eraser doesn't work very well, which is weird because this is a brand new board. But let me tell you. So, radiation after mastectomy. So let's go again. Mastectomy. So plus radiation when the tumor is equal to or greater than 5 centimeters in greatest dimension, if there are lymph nodes with cancer in them, positive lymph nodes, we say. Might not just be one tiny little lymph node, usually it's more than one, but when cancer has spread to the lymph nodes, we will consider radiation after a mastectomy. And if for some reason you can't get it all, if you can't remove all of the cancer, you leave what we call a positive margin, then we would definitely want to radiate after mastectomy. And in general, those are sort of the 3 reasons we might say, hey, we need to consider radiation after a mastectomy. Every case is individual, of course, and this only happens about 15% of the time on average. So in my opinion, it's never a great idea to say, well, I'm going to choose a mastectomy because I'm trying to avoid radiation, only because that's not true all the time. It will be true most of the time, but it's not true all the time. And we can't always tell you that until we have the final pathology from surgery available to review, so we can make our recommendations and talk in our multidisciplinary groups with the other providers to get a treatment plan for you. So hopefully that is some helpful information to you if you're struggling to decide between lumpectomy and mastectomy. There's lots of pros and cons. I have some more videos on that and some really good tables so you can go through the pros and cons, and we'll get those in some other videos.